Hi everyone, this is Jackie and I wanted to talk about pain management today, but more specifically my pain management and how I deal with it. And I chose this topic because it's come up relatively recently that I've had to kind of rethink how I'm managing my pain or dealing with my pain. The last post you guys saw me crying and in extreme pain, and yeah, I knew I had to do something. Usually I can manage it on my own. I know when to take medication, what type of medication, how to take it, things like that, but I just couldn't figure it out. I recently, as you guys know, changed a little bit my lifestyle. I moved from living at home with my parents for the last couple months, having them do everything for me, to going back to school and doing everything myself. And it is a very hard transition. My activity level is, significantly increased, which definitely increases the pain. It's freezing here. Yeah, I think it's snowing right now. Look, not quite yet, but it will be tomorrow. And it's been kind of snowing off and on since I got back a week and a half ago, and that's not helping it either. So I talked to my the PA that works with my surgeon, and I see her every time I go into the doctor's office. And we have a good rapport together. We know, or she knows, my situation, what I go through. And so I called her, and I talked to her, I guess it was yesterday, and we kind of talked about why it's happening to me. Like, I need to know why my pain's getting worse or why it's getting better, things like that. I need to know the why. And we kind of decided, yeah, it was the activity level and all that. And yeah, I feel for you guys with fibromyalgia or other chronic diseases where you just you don't know why you're getting worse. It just kind of happens. And I'm sorry if I'm misspeaking about this, or some of your guys' chronic illnesses. I don't know about them as much as low back pain. That's kind of my specialty. Okay, so so we talked about why it's happening, and we kind of discussed our options. And I kind of wanted to try, I guess not alternative therapies, but maybe like an over-the-counter or a, go lay down, do something like that. Before I increase the medications and things like that. I'd rather stay off the Duragesic medication, like the patches. I've tried it in the past, but yeah, I really don't want to increase the meds in my system. So we kind of we discussed capsaicin, which is probably the coolest thing ever. I've never actually tried it until today. It's a cream over the counter. You rub it on your where it hurts. So in my case, the back, but it feels like a heating pad, which is amazing. I kind of want to just rub it on my whole body because it's so cold here. Probably shouldn't do that, so I'll shy away from that. Just put it on the back. But we also talked about a TENS unit. For you guys that don't know what TENS is, it's electrical stimulation that you put on the area of your body that hurts. Of course, you have to avoid the head or neck or whatever. So I just stick it on my back and kind of pulsates, and it just tricks your body, just like the capsaicin. It tricks your body into thinking you're not in pain. And I've actually tried the TENS in the past, and it did help a lot. So I get my own unit this time, which I'm really excited about, and I'm really looking forward to using it. But those are kind of what the things I'm doing to I guess to manage this new pain. I don't know if it's breakthrough pain, or I guess it's just the chronic pain just getting a little bit worse right now. The pain level just increased. Yeah, so I'm doing the alternative therapies, but we also discussed pain management specialists, and those are usually it's a doctor, but sometimes it's a clinic with a bunch of doctors in different specialties, all working together to manage your pain. It could be the a physical therapist that works with your movement and whatever they do, a therapist to talk about, oh, we have chronic, or people with chronic pain often have depression, so they'll get you through the depression, or maybe not get you through, but help you manage it, and things like that. So it's an all around kind of therapy, kind of cool. But we decided that let's wait a little while before I go into that option, because it sometimes can be pricey, and I'm a poor college student. You can tell by the quality of this camera that I have no money, so I'm going to hold off on that for a little while and kind of see if the TENS unit is going to help enough where I can get by, things like that. So this is just a little update for you guys. What do you guys think about I don't know, your pain management therapy? How do you go about it? I'm really curious to see or compare what I go through and what you guys go through. So comment, post your videos. You guys know what to do. Bye.